I do want to start with this here, and that is the reason why I said I wanted to invite you on the podcast, and that is a rant. And as a lot of my listeners know, I tend to rant a little bit myself, so I always like it when other people do. And you had this epic rant, and I'm going to read it very quickly. So, rant for the day: I'm seeing more and more personal trainers posting online random exercises to address injuries. This is a really bad and dangerous trend. So, if you don't properly understand human movement from a joint tissue level and don't understand what the injury is for from a short-term, long-term perspective, and have zero ability to confirm the injury, how can you give any credible information on how to address it? Like, this is what I did to deal with the insert injury. That's what these influencers tend to do. So number one, don't listen to social media influencers just because they have a lot of followers, and you include even me, which I like a lot. Number two, don't always try to find the cheapest method. The cheapest of free information is often bad, wrong, and vague. This is why most medical providers would recommend resting in ice after an injury. For example, you saw some trainer posting about having a history of back pain. Now he does Jefferson curls and feels great demonstrating a loaded flexed spine. And I want to talk about that. Number one, not all back pain is the same and often multifactorial, which is why it's the number one cause of disability in the US. A loaded flexed spine can be very aggravating for some dysfunction, such as flexion intolerant lumbar radiculopathy, which is a herniated disc. I'm not saying that the Jefferson curl cannot be helpful, but only with the right person, someone who needs to be strong in a flexed position. In the right phase of injury, late subacute without radicular symptoms and minimal pain, who has the necessary joint prerequisites, adequate lumbar spine segmentation, and end range flexion strength. So if it is used for the wrong person too early, who doesn't have the joint capacity, you will likely aggravate the issue. And then you give an example of what you get in your DMs, like people ask you, like, hey, what's this? I feel this, doctor says that, what do I do? And the response you give is go get an assessment. And this is something that I've been a personal trainer for almost 30 years. And this is something that I've come across throughout my entire career. But also of late, it's been social media. Back when I started, it was like the glossy magazines, like do this this exercise to get rid of your belly fat, follow that diet, rehab this way, and now it's just social media influencers. So I really like your rant because it's something I've been saying to my clients and people. It's like, don't ask me, go see a doctor, get an assessment. I'm at best I am way down the line of injury and rehab and prevention, meaning you get a doctor first, he does whatever he needs to do. You might then go to a physical therapist, and maybe in third place, your therapist says, keep on training, and then they send you to me, where I contact doctor and therapist, like, what can I do with this person? And then we continue the rehab that way. So that's how I see my job. And I can imagine that you must sometimes want to pull out your hair a little bit where you see some of that stuff on social media. So long intro. But my question is, what inspired you to do that rant? Was it something specific?
Yeah, there's just there was so there's someone who I've known, like I met him personally, and he was someone where like he was thinking about going the physical therapy route, and then he decided to be a trainer. And then now with like the knees over toes guy, and more of these trainers are saying, hey, I have knee pain, I have back pain, do this. And it just, it's just not a good trend, because the problem is, so like of all of the different interventions that I can do physical therapy, generally the two most important things is going to be some type of education, whether it's activity modification, developing a plan, and then exercise. Well, trainers use exercise too. And the way that I see rehab and strength and conditioning are essentially the same thing, but they're on different sides of the spectrum. Meaning, if someone has an injured body part, injured tissue, well, how do we get that tissue stronger and more resilient? Or how do we get it to heal? Well, we expose it to a load. But the load is obviously much different if we're dealing with an injured body part versus a strong body part. But generally, as the tissue is in the process of healing, they can apply greater load and et cetera, et cetera. So I think that's why a lot of trainers feel that they can offer, injury advice because there might have been a client that, oh, they had some back pain or whatever. They give them an injury. Oh, what, an exercise, an intervention. Oh, wow, this is feeling much better. And then with social media, your reach is just magnified. And I've worked with many people who've tried, and I'll speak of knees over toe because I think he's the guy who like started everything.
Yeah.
And I've worked with a lot of people who tried his program and then it flared up their knee and they're like, that wasn't helpful. It made things worse. And I think a big problem with a lot of these programs is they're not guided. So it
Yeah.
just, here, do this exercise. Well, does everyone need to be doing the same exercise? And no. And in the case of someone like knees over toe, like if we take that concept, right? So should a healthy knee be able to go over your toe? Yes. The problem is, which is why in rehab that you hear that cue, don't let your knee going over your toe, is because let's say someone's taking a squat. We take the squat movement, a pattern, right? So we can have a quad dominant one where the knee has to shift over the toe, or we could use a hip pattern where again we kind of sit back more. Well, when someone has an aggravated knee, so like they might have some type of patellofemoral or kneecap injury. So the further that your knee translates over your toe, the more contact goes on that kneecap. So if you have a chondromalacia, patellofemoral pain syndrome, etc., that can actually really aggravate you. So that's where the cue went. Well, someone squats, their knee goes over toe, it hurts. Okay, well, how do we modify? So you change the squat pattern. But then the problem is, then there's these trainers and then there's these physical therapists that don't realize, well, ideally, we do actually want to get the knees over the toes, but at what phase? Like, when are they ready? Right? You know what I mean? And I think, I don't know what the medical system's like over in Europe. But in the US, what happens with a lot of physical therapists is really like the way that I think of rehab, like, just performance training, rehab, there's like 5 phases, right? So there's the acute phase. You're training martial arts, you hurt your knee, right? So right now your knee's swollen and it hurts. Then you do some things, the swelling goes down, the pain's better, but you're still not back to your martial art training. So you're still in this subacute phase. And usually by the end of that is when a lot of physical therapists will discharge their patients. Some of that is going to be based on them working with non-athletes. So if, like, let's say you're a desk worker, like, that's when you're done because you don't have to go back to running or high intensity things. So some of it's going to be based on insurance, right? So insurance doesn't really care about getting you back to martial art training. They're like, can you get back to like having less pain? We're done. So I think that's where, at least in the US, like, physical therapists kind of focus on those 2 phases. That third phase would be like reincorporating strength and conditioning. And that's, I think, where a lot of trainers will come in, right? Because now they're discharged from physical therapy. Where do they go? The trainer helps them like rebuild strength and conditioning. Phase 4 would be return to sport. And the reason why strength and conditioning comes first is because, we do want to make sure you're getting back to strength and conditioning, but return to sport, meaning like back to competition, high intensity, like there's kind of like a big jump of intensity. And then that 5th phase would be like performance training. So I think a lot of what happens is there's these, again, physical therapists are really good at phase 1 and phase 2, and then they're pretty crappy at the rest of the phases, which is in my opinion, a problem. So I think a lot of people get frustrated with the medical system because they go to their physical therapist or their medical doctor, and they offer them, they're not progressing the exercises based on whatever phase you're at, right? So if you take like knees over toe, for example, like, he might be just putting the wrong exercise in the wrong phase. And again, like, you can think about it, like, you take the squat pattern. Now we can regress that or progress that quite considerably. Like a very regressed squat pattern would be like a sit to stand, because everyone's need to get up from a chair or the toilet. Like, it's like but then how do we load that? Like, well, now we're adding like weight, we're adding speed. You know what I mean? We're doing like your 1 rep max. So there's a big gap on like sit to stand to a loaded squat, right? If that makes sense. So,
Yeah.
and so if you rush that phase, like, oh, well, I'm going to force your knee over your toe while it's still painful, that's a problem. So if you take someone like the knees over toe guy, I think that some of his things, like, the message is good, because Should you have strength in a long range? Yes, absolutely. Should you include single leg exercises? Yes, absolutely. But I think in the program, he doesn't go over, he doesn't have a good understanding of the intensity or the volume progression. And then, there's things that he'll throw in there that I don't really think are accurate. So he will do like tib raises because he thinks having a strong tibialis anterior is important. But I don't think that's really the case. I don't think the tibialis anterior really helps the knee. I think the act of having full dorsiflexion, so pulling your toes up towards your shin, that's really important. So while some people are like, well, it's the same thing. Well, again, the end goal is the same, but how do we get there is different. And just doing tib raises might not be enough to work on that dorsiflexion, if that makes sense. So, there was some trainer that I saw who was posting, like I said, in the rant, he's doing Jefferson curls. And, don't get me wrong, like I personally, I will do a Jefferson curl. I can program them with the right person. But if you follow his story, he talks like he had a disc herniation. He's having symptoms shooting down your leg. If you do it like the worst thing that you could do if you have a lumbar radiculopathy, like, symptoms shooting down your legs, is do like a loaded end range thing. So when he's recommending that, I'm like, that is so dangerous.
Yeah.
And the problem with social media too is you don't get to give people guidance. So again, with the right phase, can you get someone there? But if you just give someone a program and say like, do this on your own, and you don't get to like work, so now you're going to have these people that are going to keep trying to do these movements, and they're going to keep just flaring themselves up. And I just think it's a really bad trend. And a lot of these trainers don't understand that. They're like, oh, well, this is what I did and this worked for me.
Yeah.
But I'm like, that's not how injuries work, because there's a lot of different things, so again, like maybe this exercise is good for, again, if we want to think about back pain, we can classify it in a bunch of different ways. Like, is it stability based, meaning like, does someone have like micro motion? Is it mobility based? Is there just their back stiff and they're forcing ranges of motion they don't have? Is there a herniated disc? They're having radicular symptoms. And then there's some people that just have chronic back pain. It's not really as much of an issue for athletes. It's generally for someone like maybe you're like you have a physical labor job. You don't really like your job, and it's hard on your back. You have bad back mechanics. So like there's that psychological component of, like you don't like your job, and your job makes your back hurts. Well, it's so that kind of like amplifies things, so you really need to have a good understanding on what you're doing before you just give these exercises out.
Yeah, it makes perfect sense. And it's funny you mentioned the knees over toes guy, because I mean, just Wednesday I was visiting with a friend who's also been training for a long time in martial arts and combat sports, and he asked me about it. So, what do you think of him? Because we hadn't seen each other in a long time because of COVID and so on. And I said, I kind of have my doubts for some people. Like for instance, for me personally, arthritis in the toes, ankles, and knees. I'm just not going to go there because basically some of the positions that he advocates puts my knees and ankles in a really bad spot, that I just don't have the joint mobility anymore. So I could force it, but then I'm grinding just that joint and making everything worse. And that is just me. Now, I haven't seen his program in full, so maybe he does give some word of caution or just does advise to get an assessment and so on. But from what I've seen online, it's just like, okay, this is how it works, this is what I do, and so on. And I'm sure for many people it works, but for those that it doesn't, which is typically the people you don't hear about on social media, it could be disastrous. It really be disastrous. And that's something that I really liked about your rant, is that it's what I've been bumping up against for years as a personal trainer. When people have this idea, well, I saw that exercise, or I saw this guy doing that stuff, and it was so impressive, I want to do that. I'm like, well, you could, but what's the benefit, and what is the risk? What's the risk reward ratio for you? Risk is pretty high. Why? Well, because you're 62 and you've got issues with your shoulders and your back and that, and you want to do one arm pull-ups like that guy. maybe that's not the best, strategy, especially when you get older. You don't want to have the kind of injuries that will very much downgrade your quality of life to the point where it's no fun at all. Does that make
Correct.
sense
Yeah.
to you?
Yeah. And what's interesting thing about the knees over toe guy, actually. So I think he's had two different injuries on one knee. So one knee he has, and he's pretty vocal about this. So he calls it an artificial kneecap, which essentially is a partial knee replacement, meaning that what they did is that he probably had some very serious injury to his kneecap, his patella. So then they had to grind off the back and they had to put a metal cap on it. So like if someone has patellofemoral arthritis, kneecap arthritis, the positions that he recommends, he probably could not have done if he didn't have that surgery.
Mm.
So again, he talks about he had a ACL tear, look at all these things that he did. But it's like if you didn't have that partial knee replacement, you might not be able to do a lot of those things. Like for me personally, so I have pretty severe arthritis in my kneecap because I had a history of dislocations as a kid. So I would have what's called bone on bone arthritis. But from a functional standpoint, you probably wouldn't realize other than that one leg is smaller than the other. And I do have pretty significant quad weakness, but like when it comes to like martial art training, I've been essentially like I've just developed a style to compensate. So like I can do, full martial arts, striking, takedowns, jiu-jitsu, you wouldn't know. But it is there. So there's a lot of things that I can't do. Now I can still get my knees over toe, but I cannot do it loaded. Like doing a lot of deep squats with load can aggravate my knee. So again, it's something to think that even though he said I had this injury, again, if he didn't have that surgery, he might not be able to do a lot of those things that he's doing currently.
Yeah, I mean, it makes it all sense. I'm extremely lucky that one of my longtime friends is an orthopedic surgeon, really good one actually, but also a Muay Thai coach for he's been training for over 30 years now. And when I went to him a few years ago, it's because my knees were getting bad. He said, look, this and this and this, but you can train, but you can't do regular squats anymore. You need to do wall squats, Bulgarian split squat, and so on. So my VMO becomes more active, and a bunch of stuff that if you just follow whatever advice of whoever is extremely popular right now on social media, or these over those guys or somebody else, don't care, but you don't get this quality information from a medical professional, you're just going to take a huge risk on making everything exponentially worse to the point of getting to catastrophic injuries. And I'd like you, if you could, for the audience, define what is a catastrophic injury, because the term gets tossed out a little bit. It's not just an injury. Catastrophic injury is something else.
I mean, I guess a catastrophic injury would be something that's like life changing.
Yeah.
So, yeah, I mean, people don't realize this, but like even like a joint dislocation, like your shoulder pop out. I guess a good example, because of martial arts would be like TJ Dillashaw. So he goes into his last fight and he says that he's like, oh, I've had like 20 dislocations in this camp alone, meaning that his shoulder's dislocating like about once a week or more than that. And every time your shoulder dislocates, so it goes out of the socket, what happens is it'll start to scrape away cartilage. Now, when you have cartilage damage, that's essentially that's arthritis, because the cartilage is the cap between the two bone contacts. So as you lose cartilage, now you're going to get bone on bone. There is no good current surgical or medical intervention for cartilage loss. So people will say things like PRP, stem cells, they do not actually heal cartilage. So if you lose cartilage, like you're kind of screwed. Generally, at that point, it's more symptom modification until the point where they can do a joint replacement. So someone like TJ Dillashaw, so I guess he had some type of shoulder stabilization that failed, and then he went into his fight camp, and this happened again. And I think most recently, last like 2 months or so, he said, I'm going to need another surgery. This is the one that retires me. I'm done fighting, which I'm kind of suspecting. I'm wondering if it actually is going to be a shoulder replacement, which, at like late 30s, like that's not good,
No.
because, because the thing is with like joint replacements is they're non-biological tissue, meaning they don't adapt. So at some point they're going to wear out.
Yeah.
and they only can do so many revisions. So like you don't just want to like get a joint replacement. Like for me personally, like I am a candidate for a partial knee replacement, but the problem is if I do that 20 years down the line, I'm going to need another replacement. And generally they only can do the revision like once. So at that
Yeah.
point, like I don't know what the next step is, but it's not good.
Yeah, they don't like to operate on 80-year-olds to give them new knees and new this and that, because the
Yes.
surgery is so taxing on the body at that point that it's just a huge risk. And then you're screwed because your end of life quality of life is going to be very, very low. It's low regardless. That's the aging process, but you don't want to exacerbate the situation. You mentioned TJ Dillashaw and Yuri Prochaska, who apparently had a really bad shoulder dislocation. I think he's a light heavyweight. Is he still champ, or did they take away the title? I
Uh,
don't remember.
he let it go because he knew he was going to
Okay,
be out.
all right. So, and apparently that is what is being said, is that his team put it back in place, quote unquote, and just made it worse. And apparently, the UFC doctor said this is the worst shoulder injury I've ever seen. So, if I mean, for everything that you've seen when it comes to shoulder injuries, dislocations, things getting worse, if a doctor like that says something like that, it's the worst he's ever seen, and let's assume that is true. What do you think his chances are coming back to the highest level of competition?
I mean, I'm assuming if it's bad. So generally, if the shoulder was out, chances are his teammates were probably yanking on it, which means that what they're doing is that by pulling on it, they're probably causing. So when your shoulder goes out of place, there's going to be some type of labral tear because the labrum kind of gives the shoulder a little bit more stability. So chances are, as they keep pulling it, what they're going to be doing is they're probably creating more and more of a labral more damage. Which again, the more labral damage, the longer the repair or the recovery is going to be because there's more stuff that they have to do. Potentially, if they kept trying to put it in place, they could be causing more cartilage damage. So, it's hard to say like until we see him like what level he's going to come back. Um, but a good example of what it looks like, I think it was like a Bellator fight with like Aaron Pico. So his shoulder dislocated in the fight, and he's telling his corner like put it back in, and he's
Yeah.
just yanking on his shoulder. And from a fighter's perspective, I understand why he did it because when you're in the fight, you're not thinking, oh well, like I don't want my an injury. Like you want to win and you don't want to give up. So really, I'm more frustrated with the corner who's saying like, "This is not my job." Like
Yeah.
I'm not trying to. And you see, like literally, they're just in the corner, just yanking on his arm, and I'm like, you know, some people don't realize like, yes, you can get surgery, but depending on how much damage the chances of recovering to that 100% are going down and down. It's like when someone tears their ACL and then they want to go, they get the reconstruction usually like if they have to do a revision on the first ACL tear, that second one's not going to be good. Like you're going to have either some laxity, there's going to be problems, like you're not getting back to 100%. And that's unfortunately sad. And it could be the case with a lot of people who pursue martial arts at the professional level are not the type of people who are going to really think about longevity because they have a very high risk tolerance. But unfortunately, that's where the medical team, your coaches are supposed to step in and say, hey, like hopefully they can have a career where they can, train a long time versus someone like TJ Dillashaw, where he's like, it's really sad because he feels like he's at the best of his career,
Yeah.
but his injuries are retiring him. And that is really sad.
Yeah, and it's also very, very frustrating. I mean, I got my compartment syndrome. I think it must have started 20 years ago, but I couldn't distinguish the pain of the arthritis in my toes with what I was feeling in my lower leg, and it felt like okay, it's probably the same thing, but only many, many years after, when I was going to the specialist to get another injection. What is it? I can't remember the name. Hyaluronic acid. That they
Hydroluck
inject.
acid.
Yeah. That he said. I asked him about the pain in my calves and so on. He said, no, that has nothing to do with your toes. And then I started searching for an answer, and that took many, many years. Bunch of professors, specialists, and so on. Totally by accident, I went to one surgeon who had actually done this surgery like once a week for several years. So he recognized the symptoms immediately because apparently they're very easy to misdiagnose. That was 10 years ago. I'm still rehabbing. And it basically cut my career as a martial artist short. What was supposed to be some of my best years, so like late 30s and into mid 40s and so on, totally gone, wasted. And it's one thing, I'm a personal trainer doing both martial arts and conditioning, strength, and so on. So it's a part of my job to be able to do that. Not being able to do it was an extremely challenging, psychological thing. I can only imagine how much greater that stress must be for TJ Dillashaw, because like this was, like you said, he's it's had his troubles with the performance enhancing drugs that he was caught with, and then he makes his comeback. He feels great, everything's going fine, and then that happens, and then you're done. It's like your body says, "What you're done." And I'm sure he's had surgeons tell him, like, "Look, we can't fix this anymore. It's going to be over."
Yeah.
So speaking of injuries, could you? I mean, and again, this is just general advice. Like I'll give you the introduction why I asked this one. It's many years ago. I was in this course, and it was about general sports training. And what one of the teachers says was that, for instance, in sports like soccer, there are many injuries, but relatively speaking, the severity is relatively low. Whereas in martial arts, it's typically the opposite. Not that many injuries, but when they do happen, it's typically pretty bad. I don't know if this is like 30 years ago, so I'm not sure if that's still accurate, but what are some of the common injuries that you encounter in martial arts in general, and then specifically for MMA and BJJ?
So we'll break it into striking martial arts and grappling martial arts.
Okay.
Striking martial arts, specific competition, you're going to get just a lot of blunt force trauma, face damage. Breaking breaking a bone in the face, breaking your nose, breaking your jaw, breaking your hand, breaking your foot, especially if someone kicks with the foot as opposed to the shin. So like that's going to be like the most common, I would say, from a striking art, right? And then in grappling, it just depends on how you look at it. The knee is the most commonly injured area in jiu-jitsu, followed by the elbow and I believe the shoulder. I think that's the order. Like some of the things you're going to see with like the knee is going to be like a meniscus or a ligament tear. Those are pretty common. I think meniscus is more common than ligament, but the mechanisms are kind of similar.
Yeah.
So like in like traditional field sports, the common mechanism for a meniscus tear is going to be a plant and a rotation.
Yeah.
Because you're running. You're not going to really see that as much in grappling because especially like jiu-jitsu, like we're on the ground, but it could be like a lot of times like your knees kind of caught in a leg entanglement and people just kind of like try to rip their knee out versus strategically unhooking their leg and getting them out. There is obviously leg locks. A lot of injuries, though, happen with either takedowns or with positional scrambles. So, like the leg is just in a weird spot and people resisting a takedown or resisting a sweep. And then in that scramble, in that takedown, the knee goes away. It's not supposed to. So the knee has like every joint has 3 potential degrees of movement. So it's the sagittal plane, then we have the frontal plane and the rotational plane. So the knee can move, it bends and it has slight rotation. That's how helix work, but it doesn't bend to the side. So a lot of injuries happen like someone's falling on their leg or their knee torques inward. So that's pretty common. I would say with like the elbow, a lot of injuries. I think the 2 most common in elbow injuries are going to be people not tapping to an armbar or people posting their arm out. Like they like post to either stop a sweep or take down and elbow dislocates. I think like a good example of that would be Shogun Hua versus like Mark Coleman. I think this was in Pride, like I guess 15 years ago or something. So, Mark Coleman goes for a takedown, Shogun post, elbow dislocates, fights over. So,
yeah, I remember that one. And I think Coleman kept going a little bit after that. Everybody was pretty angry at him.
And then like, we can think of like, I think neck injury, if you look at literature, rib injuries are actually fairly high, which is interesting because clinically, I mean, I see them, but it's not as high as like some other things. But it also could be that a lot of people don't go to rehab for rib injuries, like they pop their ribs, and when it comes to like medical advice, they just say just rest, which I don't 100% agree with. I've rehabbed a lot of ribs because ribs is like anything in the body; it's damaged tissue. We want to make sure that that tissue can become more resilient and we can restore the function of everything that happens to the spine, because ribs attached to the thoracic spine, your upper back. So I have to make sure we can restore all the movements that your thoracic spine could do previously. So again, you can rehab rib injuries if you're working with someone who understands how. But a lot of medical professionals say, "Oh, you can't do anything for the ribs," which is not accurate, in my opinion.
I remember many years ago that I was with my sports physician who'd been, treating me during my competitive career and so on, and I'd been doing Tai Chi Chuan for a while then. So for a variety of reasons, it is not the soft part that people make it out to be. There's a reason why it's Tai Chi Chuan. Chuan means fist in Chinese, so it is a martial art. Obviously not the type of competition that you have in MMA and BJJ, but still it has an interesting approach to things, and lots of breathing exercises. When I asked him, like, look, put your hand here on my rib cage, and I could, without inhaling, move that rib cage from the left side out, then only the right side, then front and back, and so on. It was like, I have no idea how you do that, and and I was like, yeah, lots of training, and this is something that I think so many practitioners, unfortunately, only discover very late in life, is that the human body is this bizarre blend of being extremely resilient and scarily fragile at the same time. And if you don't treat it correctly, it's eventually going to lead to problems. I remember being a young martial artist many decades ago, reading about you have to train your stabilizer muscles as well, because they're also important. And I'm like, I can move well. I don't need no stabilizing work. Fast forward 20 years, is like, this is some of the work that I do the most. So a lot of prevention, injury prevention, and so on nowadays, as opposed to loads and loads and loads of strength and conditioning when I was younger. It's getting old, man. I'm 51, so
Hey, you're still in it, man. That's what we can all hope for.
I'm going to try to keep going until I drop. So that's my goal. Something you mentioned on your Instagram, which I also thought was important. You mentioned that neutral spine in combat sports is not really all that common. Could you expand a little bit on that?
So again, we go back to the phases. A lot of times when people have back pain, and we think of back pain, we can think of more athletic back pain, which is usually what happens is someone would have a spinal buckle or they throw out their back. Okay. So what happens, you take the lumbar spine is 5 vertebrae, your thoracic spine is 12, your sacrum is a fused joint. So it's not like one joint. There's 19 joints to 16 joints. 18, sorry. Math. Anyway, 18 joints. So that's a lot. So what can generally happen is one segment is forced to move more than it's supposed to. So think about it this way: like, let's say you had you needed to move from your house, and you have your 5 friends, and then 4 of your friends are just laying around drinking beer, and then one guy's doing all the work. Well, what happens? That one guy's going to get beat up. That's a good analogy we can think about the spine. So something what happens is that one segment is forced to move more than it's supposed to. It buckles. So in that acute phase, so now movement hurts. So what do people do? We'll stop moving. And it is important to identify your pain trigger, meaning like what movements hurt, which tends to be flexion, bending forward. Again, athletically, So initially, it's good to avoid that pain trigger, because if you keep just forcing yourself in the movement that hurts, well, you're just going to keep irritating it, and you're going to delay your prognosis. So that's where they kind of start. Well, let's do neutral spine, and then people start doing core training in neutral. The problem is after those first 2 phases, after we restore some of that ability to bend, especially in martial arts or really all athletics, is the spine is designed to move, and it doesn't have to just move. it has to be strong. So we have to think it's not just passive flexibility. How much can you bend? Is how strong are you in these bad positions? So, there's a prominent spine biomechanist, Stu McGill. He
Yeah.
did a lot of research on the spine, and even though I disagree with how he handles some of his stuff, he does have some really good literature. And and he was one who said, hey, if you overload the spine in flexion, you're more likely to cause a herniated disc. But I mean, the biggest problem with a lot of his literature is that he's using it on cadaver. Well, he's using it on spine, pig cadaver spines, but cadavers don't adapt, and your body will adapt. So that's like the one biggest thing that people argue with his stuff is he doesn't take into account biological tissue can adapt. But anyway, so he's like, well, if movement hurts, and then he started looking at some core training, and that's where he came up with the McGill
Yeah, the
Big
McGill 3, yeah.
yeah. And, and like when I was an early clinician, I use those a lot. And again, in the first two phases, they're helpful because, well, we want to avoid the pain trigger. We want to start getting things going. The problem is once you get to strength and conditioning and return to sport, now that person's going to be forced out of that neutral spine. And I remember, so I competed in Nogi Worlds in December. So I was getting ready for it. I knew I shouldn't have, but I did anyway. So I roll with this guy who outweighed me by 100 pounds, and he didn't do anything wrong. He's just a big dude, and boom, hurt my back. And it would be essentially, it was a flexion intolerant stability, meaning like, is if I could keep neutral and I was good. And this is, and this, I'm not using this as an example. This is what I did to get better. But I remember I had no ability to play guard. Like literally I couldn't, because if you want to play guard, there's always going to be some level of spine flexion, meaning,
Yeah.
as your knee. And, but then I could go to the gym, like I could deadlift pretty close to like what I'd been deadlifting. I could do like a 70-pound like Turkish get up because I'm in neutral. But even the simple like drilling guard, I could not do. So if I solely focused on staying in neutral, I'm doing all this stuff and I think I'm getting better, but I'm not, because ultimately I need to be able to restore flexion and I need to be strong in these weird positions. And I got lucky because like I remember if like my back hurt for another week, I was going to pull out, and I ended up doing well off my closed guard. So if I did not, if I didn't recover where I needed to be, I was going to be kind of screwed. But as we're returning that athlete to sport, again, we need to restore the ability to move in these positions, and then we need to make someone strong there. So I think that's where, physical therapists who don't work with athletes, because again, they're not really pushing that return to sport. They kind of don't know what to do. And I think, again, that's the problem, because they discharge people before they're really back to sport. And when it comes to return to sport, for me, it's a combination of, can the joint do what it's supposed to from a mobility and strength perspective? And then can that person tolerate sport specific movement? So in jiu-jitsu, can they tolerate that loaded spine flexion? Because even just guard retention is a loaded spine, because someone's putting their weight on you, whether you want them or not, and your spine's in some degree of bend.
Yeah.
So those are kind of like the two things that I look at as I'm getting someone back to sport.
I agree, and I think, I mean, and being one of them, mea culpa, I'm guilty as well. But martial artists and combat sport athletes are the worst when it comes to dealing with injuries, I think, and just rehabbing correctly. You mentioned it well, is they go to physical therapists, and then the therapist says, we've done all our sessions, you're good to go. But actually, that should be the start of a prolonged program of, like you said, just slowly building up to elite level performance again. And I find it so funny because in many other sports, when you look at professional athletes, it's not the case. They are so much farther ahead than combat sports athletes when it comes to just, it's getting better. I think the UFC Performance Institute is doing a really good job on that front, but it's getting better. But I can just watch. I mean, a little while ago, I was watching one of the women's 4x100 meter dash team here in Belgium. They were doing prehab and injury prevention, and there was some hardcore, difficult stuff there. If you want to do like one leg bridges and bouncing off your toes. It's like you need a posterior chain that is pretty much really good to do that. And all this kind of stuff that you never see, or at least I have not seen some of the mixed martial artists and BJJ guys do when it comes to just like, look, this is really good stuff. It might be boring for you, and you're not going to get huge muscles out of it or getting semi-strong, but it's going to prolong your career for a significant amount if you do this stuff right. So and I think that's something you focus on a lot. Just like you've mentioned it many times on your social media, like the longevity of an athlete. That is important as well. Could you share some thoughts on that?
Yeah, so I think pretty much to you said something important. So my job as a rehab professional is not to get someone out of pain. Like that's easy. Like, that's why like you go to your physician and they say, "Oh, I have back pain. What do I do?" Well, stop doing your sport. Boom, like easy. But that's not the answer you want. So getting someone out of pain is not my job. My job is to get the previously injured tissue to restore its resilience so it can tolerate sport, whatever that means for you, whether you're a recreational hobbyist or you're a professional mixed martial artist. Like obviously it depends on where we're going to go and how far we have to go, but that is my job. And I think too many people, they're like, I'm out of pain, I'm done. You're not done. As you said, that's kind of when the fun part, like that's what I actually get to do stuff. Because when you're in pain, I'm really limited with what I can do. So I have to, part of the rehab process is I do have to respect pain. But I mean, unfortunately, that's not my job because tissue damage and pain have a loose correlation, but it's not 100% because pain is a neurophysiological response, meaning your body perceives damage, your brain sends signals to that area, releases hormones, and makes it more sensitive so you stay off it. So that's why pain is not necessarily what I look for. And that's pretty common with ligament injuries, right? Like, so you ever people like they sprain their ankles and they're like, "Oh, I have a history of sprained ankles." Well, why is the ankle sprain so common? Because it's never fully rehabbed. It stops hurting and they go back to training. And you said like martial arts are the worst. They're like, "Oh, I can't raise my arm overhead. I just won't let anybody grab my shoulder." Like, that's not what's going to happen. Like I'm a black belt. Someone's going to grab my shoulder whether I want to or not, So yeah, I think that people need to get this through their heads that if you want to have longevity, so I'm 38 too, so I would like to be able to be like Helio Gracie, where I'm training into my 80s or 90s. And granted, he's not rolling with like D1 wrestlers, but he's doing some level of martial art training into his pretty much until his deathbed. And I really think that should be a goal of everybody who's a martial artist, right? And a lot of it is if you can address an acute injury early on, it's much easier to manage. So when people wait for their injury to become chronic, it's going to be much more difficult to address because one, the tissue quality of that joint is going to be much worse. Now with that chronic injury, you're going to develop these compensations. So as opposed to just having like a knee injury, now like your hip and your ankle is problematic because they've had to compensate for the injured knee, right? So if you have an acute injury, see a professional. Again, I'm biased, but I think like get it managed early because that's much easier to take care of than you're like, "Oh wait, I've been dealing with this injury for 5 years." Well, it's no longer a quick fix. Now we're gonna have to put some work in to get it going, and you know, I do think that hopefully with my social media, I can kind of make these athletes realize it. And it's very interesting because I'll talk to these people, these injuries. They're like, "Man, I just want to get back to the mats." And I'm like, "Well, this is what you have to do." And they're like, "Well, I don't want to do that." So I'm like, so that means in my mind, you're not that serious about it. And, we do have to think about the financial situation. Like in the US, there's, I was actually talking to a fighter today. It's baffling, like because of because there's not a lot of money in MMA, almost every professional mixed martial artist I know, almost everybody has no health insurance, even if they're not in the UFC. And you have to think like, yes, the UFC, if you're a UFC fighter, you have access to the Performance Institute, but that's in Vegas. So if you don't go to Vegas, like you don't have care.
It's crazy.
So I do get the financial, but again, if you're an athlete, like your body is a vehicle. So if your vehicle isn't able to get you to that, 100%, you cannot express the skills as much as you'd like. And that's usually what happens when people retire is they accumulate all these injuries to the point where they can no longer do what they need to do, like TJ Dillashaw. So he's too many injuries. He no longer can train the way he wants. Well, that's when he gets retired. In a perfect world, you could be like Khabib and you could retire when you would like, or you could, it's an imperfect world and you could be like TJ Dillashaw and your injuries retire you.
Yeah, yeah, and speaking of professional athletes, I interviewed Andrew Wiltsey a little while ago. That's episode 118 for the listeners. And but you helped him out with a back injury. Could you talk a little bit about what is it like to work like a high level athlete like him, and like he blows out his back, like, and now what?
Well, he's difficult to deal with. So it all started because I forget if I must have followed him beforehand, but he's like I threw out my back, and he posts something on social media. What do I do? And essentially, I called him an idiot. I'm like, dude, you're a freaking idiot. Like, what are you doing? Like, because now he's getting these random people like what we talked about earlier. They're just giving him advice. So now you're just taking a whole bunch of bad advice from people who don't know what they're doing. And what are you gonna do? So I was like, dude, what are you doing? And and then he started talking to me, and then I was like, okay, like we started talking. He's actually very respectful, he's one of those athletes. He's very intelligent, like, and you can tell, I think, by the way, so we started talking, like, let me help you out. uh it was probably a bad time for him because that's when he was dealing with a lot of his
Yeah,
psychological issues that he's discussed. So I sat down, I gave him some stuff, and then he kind of disappeared for like 6 months, 6 weeks. I'm like, okay, and he's someone like, he gave me his number. Like, I'll text him, he doesn't respond because he's very ADHD, so like he just doesn't respond. So I just assume he just blew me off. Okay, whatever. And then a few weeks later, he gets back to me. He's like, "Man, that was so helpful. Like, thank you." And then we did I forget what I think we did like two YouTube episodes, and then he disappeared again. But I think he is back on track, and he's able to help him. So he's someone difficult to deal with, but at least he listened to me when we were face to face.
yeah, and that is something that it's if you're not a competitive athlete, it's hard to understand. But and especially in a sport like you have in combat sports, it's not a team sport. It's all about you. So your life revolves around you, your training, your diet, your everything. Everything else has to become second place. Everybody else including, and it's all about your training, and you need to win all those matches and so on. So working with athletes at a minimum, you will have these not only wild and unpredictable characters, but very strong-willed people, because you don't get to be a champion if you don't have a strong will. Now, a lot of people, yes, Georges St. Pierre said I was always afraid before fights and stress and this and that. That's not what I mean. Strong will meaning he was putting in the time in the gym, scared or not. He was training his ass off. Um, so I can imagine if you run into some of the people that you're like, okay, how am I going to handle this one? It's going to be you have to convince them. But I think it helps. Like you said, you're an athlete yourself. You know what they're going through. You know what they need to do, and this is why I very early on in my competitive career went to a sports physician, because he would tell me like, okay, instead of rest for 2 weeks, it's not going to happen. I don't have time to rest. It's like, okay, don't do this. You can do that. But if this happens, you come back, see me. Go. And he never blew me off, or he'd just take out his, this is a long time ago, his big medical atlas show like this is the joint, this muscle right here, that's the problem. So you can do all the other stuff, but don't do that because it's going to mess it up.
And what you just described is what I would hope most medical professionals do. Not everyone has that skill because you have to take, I think that's the problem too. Like, people go to their primary care. Primary care, like, they need to know a ton of things. So essentially, their knowledge with musculoskeletal is not fantastic. So they're like, I go to the physician, they don't know what they're talking about. But again, there's levels. So like, generally when it comes to musculoskeletal, the orthopedic surgeon, they know the best. So they can give you recommendations. That's not just rest and ice. It's activity. So rest means it's really supposed to be activity modification. What can or can't you do? But you need to understand the sport, the athlete, to be able to give that. And not everyone does that. Or at least in the US, they don't have time. So they're like, oh, quick rest. you obviously found a higher quality medical professional, which I would hope that most of the people in medicine could strive to become.
Yeah, it's still difficult. I mean, you go to general practitioners and he's going to give you rest and maybe it's a painkiller. I mean, about 4 or 5 years ago, I tore my supraspinatus clean off and had a big tear in the labrum. Doing a stupid workout, I was warming up on the heavy bag, doing my 10 rounds for that day. And after 2 rounds, I get a phone call. It takes less than 5 minutes. So I know I'm cooled off. So I start, I'm going to go slow. And the first like light body punch I throw, I feel the stabbing pain. I'm like, I'm fucked.
Yeah.
So I go see the doctor, and it wasn't my usual doctor because they were in this, practice with a bunch of doctors, and he wasn't available. This relatively young doctor, and I said, look, I have a shoulder cuff injury, and she says, does all the testing? I said, no, you don't. You can hold this and that. Yes, I've been training, since I was 18. My other muscles are pretty strong. It's going to be fine. But I am telling you, I know this is not an inflammation because I've had inflammation before. This is a serious injury. No, 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 no. Take inflammation meds for 2 weeks and this and that. I'm like, okay, I'll do it anyway. I go back after 2 weeks, same problem. Yes, we're gonna get a scan. Scan says exactly what I described. And unfortunately, by that time, I'd already been in contact with my friend, the orthopedic surgeon, but he doesn't do shoulders. Puts me in touch with the right person, get a surgery, and then when the sutures had to come out, totally by accident, I'm back with that young doctor because she has to do it. She
Wow.
hardly looked me in the eye.
Oh, that's funny.
Yeah, it's so I've learned to actually, push back with doctors. It's like when they blow you off, and this is something I've told many people, it's like, look, you're sitting there, you have to understand that over here, I don't know in the US, but over here, um, very few doctors will be looking at, your case beforehand, looking all the test results and understanding who you are and so on before you come in. The vast majority is you come in, what's the problem? And that's the first time they open your case and see what is going on here. And they quickly scan stuff and then you go. That is not what you need as an athlete. You need somebody, like you said, who understands what you're doing, what you will do once you get out of his office, and needs to work with you if need be to find a compromise in training, but give you this path towards full recovery. That was my rant.
Well, it's interesting. This might be a study in the U.S., but there was like a study that, and I think it was a study by physicians, and at least in the U.S., I think they spend on average 8 minutes with a patient. So, and the problem with medicine is my job when I'm working with someone for a musculoskeletal issue is not to rule in a pathway. Hey, I think this is a labral tear. My job is to rule out. I want to make sure it's not this, it's not this, it's not this. It has to be a labral tear.
Yeah.
Obviously, that takes time. And a lot of physicians don't have that.
Yeah. And speaking of, I mean, good information, you've got a course, a healthcare course, treating the jiu-jitsu athlete. What is that specifically about, and who is it targeted at?
So it's primarily for the medical professional. I'm a physical therapist, so it's really for physical therapists. But anyone who's like a chiropractor, an athletic trainer, even a medical doctor would benefit. Would a strength coach benefit? Yes, they would. Obviously, I talk about things, but it's primarily for the physical therapist. But as you imagine that jiu-jitsu is a growing sport, a lot of people have no concept of dealing with a grappler. So really, I was like, I had so many people reach out to me. They're like, I would like to get more information on working with jiu-jitsu athletes, but unfortunately, nothing existed. So I decided I was going to create that. So it's a 9-hour course. It's a self-paced virtual course where I talk about what jujitsu is for those people who might be very new to martial arts. So I kind of break it down, what is it, what to expect, what's the difference between a hobbyist versus a competitor versus a mixed martial artist, because obviously that really changes things. We look at the injury trends, we look at some of the unique injuries that can happen. I talk about the rehab phase, kind of like what I touched about, phase 1 through phase 5, what it should look like, what are our goals for each phase. I discuss return to sport. I include a lot of videos too for some movement milestones. Like one of the things I'll do after knee injuries, can you fully kneel like you're sitting in someone's closed guard? something like that. I use a lot of different movements. So these are sport specific movements like solo drills that I use in combination of, can the joint do what it's supposed to? And now can you do this movement that is relevant to grappling? And then some of the things that might be more relevant to like a personal trainer, I talk about like understanding the physical demands of like a jiu-jitsu athlete. How do we optimize a jiu-jitsu athlete? So this is going to be so that that physical, that personal, or the physical therapist has a better understanding to develop their long-term strength and conditioning, because unfortunately many are not great at that. And then the last part of the course, I discuss concussions, because really like the coach is the first one who's going to notice someone has a concussion. So a lot of concussion is just awareness and knowledge. So, I have a long section on that, and then how we rehabilitate someone with concussion stuff. So, it took me longer than I was hoping, but I was really excited about that course. So, if you're with a medical professional who does not understand your demand, get them to get the course.
Yeah, and for me, this is one of the most important things. Then, and that's why I specifically mentioned it. Is we need more medical professionals and coaches and trainers to be aware of all this stuff. There is, unfortunately, martial arts have a long historical background. A lot of the training practices, including in MMA and BJJ, come back from an era where there was not that much sports science, and a lot of it is just either bullshit or a lot of it. Some of it, I'm going to be polite, not everything, but there are a fair number of things that you can find in any, even good MMA or BJJ gyms sometimes, that are just antiquated. They're just anachronistic stuff that you just don't do. Please don't do that anymore. And if we can get more people to the point where, for instance, concussions are taken seriously and treated correctly, again, longevity, but also, CTE is a real thing, and you don't really want to have that when you're 40 or 45. I just had a little while ago, a student of mine came back to my MMA class, and we were talking and this and that. And I was talking about, how do you create a knockout, the effect on the brain, and how do you create that? And he said, yeah, but you can harden that, right? I'm like, what do you mean? Well, if you get more punches to the head, you get more resistance. I'm like, no, it's the opposite. Everything gets worse. You get weaker. That's why we call it getting a glass chin, is because you will go out sometimes by the lightest contact. And one of the best examples is Jérôme Le Banner, the K1 fighter. And K1 is older, obviously, but he was just a specimen, impressive guy. But he got knocked out so many times and knocked down so many times that he had a glass chin at the end of his career. We don't want that. So education is a big part of that. Whether you're a coach or a medical professional, it's just like you said, knowing what you're talking about, what is specific to the sport, it makes a huge difference. And the saddest thing that I've seen, and I'm not going to name names, but several high-level combat sport athletes, when they get older, just completely broken down, crippled, and you remember them from their fights and what they were able to do, and then you see this husk of a person, of an athlete, still there. The mindset is there, but just completely broken down. Why? Because of bad information, bad practices, bad medical care. And like you said, it just blows my mind that you've got, professional fighters with no healthcare plan. It's just, I'm going to stop ranting because we've been going for about an hour, and we have to get to the bonus part on Patreon. I think you want to mention in closing, Mike.
No, I think we touched on everything that I was really hoping to touch on. If you're an athlete, take your injuries seriously. Find someone who will listen to you. Develop your medical team, and if you don't, reach out. Maybe I can find someone who can help you.
All right, where can people reach you? I'm going to include all the links of some of the stuff we mentioned already, but where can people reach you? Or they'll be able to find it in the show notes.
Best place would be my Instagram, which is the word Dr._Kickass.
Best handle ever, by the way.
And then if you're interested in my course, you might as well. I'll just send you the link because it's a long link. But Instagram's usually the best way to reach to me.
Okay, and I very much recommend everybody follow Mike on his Instagram, because it's like I said, it's just a mere fact that you say, like, look, here are my sources, here are the studies, here's what I just said, you can look it up here. I'm not pulling it out of my ass. It's this is actual science. Or you, like what I really like when you did the Instagram post about that recently you got the whole lawsuit of the BJJ instructor breaking the guy's, well, cervical injury and so on, where you talk about just like what is that like, what are the dangers, and you, in closing, you say like, look, I'm not, you don't want to start this whole flame war and people getting upset. Just like we're talking about the risk, it's talking about preventing dangers. That's the goal here. So, and it's sad that we have to do this nowadays.
Yeah.
But anyway, I'm going to stop ranting. We are, so for the audience, we are heading over to the bonus part on my Patreon, and you'll find a link in the show notes where Mike is answering some of the questions of my patrons. I've got a few good ones, so this is going to be fun. Mike, thank you so much for taking the time to this. I really appreciate it.
Thanks for having me.
All right, folks. Talk to you guys next time.